In the heart of Kenya, thousands live with visual impairment, their world shrouded in shadows. But in Vihiga County, change is on the horizon. This is the story of the Vision Impact Project Kenya, a 4-year initiative transforming lives through eye care.
For a long time, we've not had a well and strong, robust system in eye care in Kenya. And it began through a discussion on what can be done to strengthen the eye care in the country. And so as a result, this project was proposed, and this was guided by evidence. At the beginning of the development of this project, CBM conducted a situational analysis.
In Vihiga County, preventable blindness remains a critical challenge. Many struggle with cataracts, refractive errors, and other conditions that limit their potential.
Eye health, and if you'll allow me, the non-communicable diseases are neglected by the county health administration, not for a bad reason, but because of competing interests. So you'll find that funding for them is not prioritized. It is that gap that the project stepped into, and when we look at it in the end, we find that it did as much as it was set to achieve, and even more.
One thing that came out before and even during the project implementation period, people were not aware that eye health was a key health problem, and some of them did not go to access the services. Number two was availability of those eye health services. You'll find that only specific hospitals were able to provide the eye services. But with Vision Impact Project, we were able to make sure that the eye health services are available and accessible in all levels, from the primary health facilities to the secondary and even to the tertiary.
Christian Blind Mission has helped the facility to improve eye care services, both at the community and at the facility level, whereby they've been conducting screening services. They've also been providing treatment free of charge at the hospital, and this has really had a great impact in terms of eye care services, the community facility linkages, improving, even strengthening the community facility relationship at large.
Nangwangwa Harrison Buraje, wakola washim Buraje, nula ijuye na ndi mkulima, yani mundu kulima matuma ni misala ni ndaka. Na hanu ndamenya hanu, hajibuye hanu, Vihiga chosi. Na zimoni ziyanje, daranga, nindu wala zimoni, babu yanje hulaho, ni zimoni ziranga, darula atao. Paka ndahamana nazo Vihiga minyishi. Nimbenza zami khatola atao. Chiri ndoli mundu, ndoli bandu babiri. Umundu mula wenyena ndola bandu bino babaka. Nanzile musibitali, wa misi, watakitali, bakole likasi ndai sana. Nze meshimu hawa, paka zimoni ziyanje ziro lichembe nidu wa shindi chosi dao. Khayembeni ngombe ndayinji, ngombe kurinji, paka sakala. Ngini manyuitira tao. Paka mbana biza basakali ngombe ne. Nondi ni simbu hanu, kumbure ni samanga. We
are very few eye workers, very few doctors. We want a technology that will be able to be put in the hands of people who are not so much trained or who are not doctors, to identify people with problems. So we developed now this app as well to be used by community volunteers. And now when we combined all this, so all these apps were basically what we were doing, and we tested, validated them, and they seem to actually be working and be able to bring in more people to eye care. So we now combined the school project together with the community project, and Vihiga County was really one of the first counties for us to do a combined project of community and school.
Technology is revolutionizing eye care. Peak Vision's mobile screening tools bring diagnosis and follow-ups closer to the community, ensuring no one is left behind.
Mimi naitwa Benedetta Mongeli Ahaya. Mungu alinisaidia kupata twins, kijana na msichana. Sikugundua mmoja alikuwa na shida, na nikaanza kuwalea. Wakati walienda shule ndio niligundua huyu kijana alikuwa na shida ya kuona, kwa anaona vizuri. Alikuwa anafunga macho moja ndio aweze kuona kwa blackboard. na nikawa niko na shida kwa sababu si kuwa na uwezo ya jinsi ambavyo ataweza kutibiwa. Sasa siku moja nikaenda Sabatia, wakaniambia mtoto ako na shida ya ako na cataracts macho zote mbili na anatakikana afanyiwe operation.
Nashukuru CBM, sikuwa naona vizuri, ikanifanyia operation, sasa naona vizuri, naweza andika vizuri, naweza cheza vizuri.
VIP has just not helped with the restoring sight through surgeries, but also it has enabled the county to plan itself. You know, we're able to do the RAB, so we know the situational analysis of the county where we are in terms of the prevalence of various eye health diseases. Like we know the prevalence of cataract, glaucoma, and the like. And having worked with the Kenya Society for the Blind as part of the team, we've also managed to support issues to do with the uncorrected refractive errors.
First, since the establishment of the eye unit at the County Referral Hospital, there have been some provision of equipment. Majorly we got slit lamps, and we also have tonometers. So the things which we were not able to do previously, let's say things like taking eye pressures, which currently we are able to do. And then also we received operating microscopes, which also helps us to do operations at the county referral hospitals. But then in terms of also the patient numbers, we have seen some great improvement on the patients who come to seek eye care services.
Vision Impact project, I would say it has come in quite handy, especially in this era, whereby in the community you screen patients through the system and also refer them to the next level of facility, healthcare facility, for further services if at all they need a referral. Because you can even do the screening at the lowest level of the facility in the community.
Visual Impact Project has improved services in the county through various ways. One, it has improved infrastructure by providing an eye unit at the county referral hospital, equipping the eye unit, providing ophthalmic equipment for diagnostic as well as surgeries. Not limited to that, we've also had Visual Impact Project training human resource in the county. Initially we've had like 2 staff trained in the county, but through the funds or the support from Visual Impact Project, we've been able to train at least 20 ophthalmic assistants who have completed certificate course at Sabatia, and we have around 13 who are at school. They are still ongoing, they are finishing their course soon.
CBM has had a long partnership with Sabatia Eye Hospital since 1996 when we were breaking the ground here. They are our partner when it comes to promoting access to accessible eye health services, which are very responsive to the needs of diverse population in this county. And by this I mean we have programs in the areas of training of health workers, surgeries, outreaches, in terms of screening and treatment. Also we support in terms of infrastructure development as well as equipment and so many other areas. So
I'm really impressed about the hospital and what the team is implementing. And I just saw a children's eye hospital, and I'm really impressed how child-friendly is the equipment.
Innovation is key. Peak Vision technology allows real-time patient monitoring, improving efficiency in healthcare services.
For Vihiga County Referral, we constructed an eye unit which can accommodate a good number of patients, and I'm happy that there's now ongoing work there where patients can walk in and they receive care. So after establishing the infrastructure, we also did ensure there were adequate equipment, and so at the county referral today I'm happy that we have state-of-the-art equipment.
Vision Impact Project was necessitated by the fact that there was a very high disease burden on matters eye care, whereby the designers oversaw a very high population of persons who are at risk of going blind due to inability to access eye care services.
Through VIP project, we made sure that majority of our staffs have been trained in basic eye care services. They're able to treat our people and generally offer eye care services.
Vision Impact Project, I will say it was a game changer for eye services, not only in this facility, but in the entire county. Yeah? One, it started as a discussion that eventually evolved into a comprehensive eye service delivery. And we thank the teams that were involved in that initial phase, the team from CBM, team from Sabatia, our county team led by His Excellency the Governor, Dr. Wilbur Tichilo, and the eye team.
The VIP project has been facilitating a lot of outreaches, even as soon as last weekend. There are outreaches, they have gone to our health centers and our sub-county hospitals, and they have helped us with outreaches. And in those sub-county hospitals, they have given us disability-friendly amenities. And these are very important: disability-friendly toilets, the rails that help the people living with a disability have also come to us through the VIP project.
VIP will soon come to an end, and because of that, together with the county government, we are making plans to ensure that the same service delivery and access to service delivery continues. Some of what we have done is developed county implementation plans or county action plans that will see continued improved access to services.
Bringing sustainable eye care is not without challenges. Limited resources, medical staff shortages, and funding constraints test the resilience of healthcare providers.
We also trained about 35 ophthalmic assistants, or what the team that went through what we call the ophthalmic skills upgrade course. These are nurses or clinical officers who had an interest in eye health, and they were given 3 months training.
I want to thank the CBM project for sponsoring me to do a higher national diploma in ophthalmic nursing. I enrolled at Kenya Medical Training College in the year September 2022 up to December 2023. I graduated as an ophthalmic nurse. I'm very much gratitude for the support they gave me.
As the project nears its final phase, its impact must continue. Integration into the county's healthcare system ensures long-term sustainability.
Today we are thankful for Vision Impact with the help of CBM, who have played critical roles to see that the people in Emuhaya at least have the eye problems, especially the cataracts, are resolved.
We thank for this project that our people have been helped. At least after the surgery, a good number of people can now be seen.
Without the support of County Health Management Team, CHMT, without the support of Dr. Ben Induswe, Dr. Martin Osotsi, committee that we worked with at the Eye Health at the county, and without the support of the CEC for Health, Mr. Julius, I believe that implementing this project would have been very difficult in this county. For that reason, I'd like to express my appreciation to the county team for that, and the support we have got from the office of the governor also. And then I'd like to also mention the support that we got from CBM. It has been constant and it has been immediate. It has allowed us to do a lot of things even on short notice. I will not fail to mention working with Faith Kasoli, the program manager for Vision Impact Project in Kenya. I'll not fail to mention Kennedy Odero, who is the program manager at CBM. I'll not fail to mention David Munyendo, the country director for CBM. And I'd also like to take this opportunity to appreciate and express my gratitude to the German corporation, BMZ. They are the ones who funded this project together with CBM. If it wasn't for this, most of what we have done in Vihiga County may not have moved, and we would not be where we are.
A future where quality eye care is accessible to all is within reach. Together, we can make it a reality.